Good morning, everyone. I'm Muriel Bowser, and I'm the Mayor of Washington, D.C., and today we are providing a situational update on the district's response to COVID-19 in the district with a focus on public education. We are located in the Old Council Chambers at 441 Judiciary Square. I want to thank the members of the press and all of the people watching for your patience this morning. We had some updates that we wanted to make sure were absolutely right in presenting to you this morning. Today, we are planning to make an announcement about the upcoming school year, and we will get to that in just a moment. As you know, we continue to monitor our COVID-19 data very carefully. And this morning, we reported 50 new cases of COVID-19 in the district, and sadly, 3 lives lost. And here are the other data points that you are familiar with watching that Dr. Nesbitt and her team monitor carefully. And we'll ask Dr. Nesbitt to talk a little bit about that data in a moment. But I wanted to be here to share with families, students, and staff information about the upcoming school year. And today we will talk about the upcoming school year, but not the way we expected to be able to talk about it this morning. We know that the situation with this virus is changing and has been volatile. And this week especially, we saw some trends in our data that are not ideal for making plans for the remainder of the school year. So we're going to watch that data very closely over the next 2 weeks and delay our decision about the upcoming school year until Friday, July 31st. We, however, wanted to talk largely about what the Chancellor intended to talk about today, because if we are able, and the health indicators allow us to, on July 31st, we will present several options for DC parents. And we're going to talk about those options in some detail today. Let me also say that we continue planning for our Summer Bridge program, and we have made the decision to make the Summer Bridge program an online program for 3, 6, and 9th graders. And that program begins on August 10th, and already over 3,000 families have signed up to participate in the Summer Bridge program. So before I turn to the Chancellor to talk more about the options that we hoped to be able to offer our families, and that decision we will make on July 31st, I want to go back to the metrics for Dr. Nesbitt to walk through.
Sure, and thank you, Madam Mayor. So overall in the district, we're in a good place. We've been able to have things like our positivity rate be at 3% or below on most days or on a weekly average. Our hospital capacity remains in a good place, consistently at 80% or below. And our COVID-related hospital admissions have not been increasing, unlike many states. Our contact tracers, we have a well-resourced and well-staffed contact tracing and disease surveillance operation at DC Health, where we're able to make contact with many of our positive cases, as well as the close contacts that they report. We have a number of other internal metrics that we look at in terms of the percentage of interviews that we complete, as well as the number of contacts that individuals report, and all of those things are promising for us. However, there are 3 metrics that are of concern for us right now with our community conditions that have led to the recommendation, and as the Mayor has reported, the decision that we want to revisit related to schools on July 31st. Those things are related to the rate of transmission, or the low transmission rate as pictured here, R0 or RT, has been above 1 for the last few days or last several days, and we want to have the opportunity to monitor that and see if it will decrease and be below 1 as it had been for the last several weeks. The other thing is that as we moved into reopening, we expected to have new cases. And that is because as there are more activities in the community for people to participate in, and we've done the aggressive messaging of making sure that people wear their mask, that they stay 6 feet apart, that they choose which activities that they're going to participate in wisely, there may still be some activities as people are reorienting in the community and making those wise decisions. However, the amount of community transmission and community spread that we have at this point and our inability to consistently see declines in new cases and community spread is not where we would like it to be at this point. And so additional couple of weeks of observation would be beneficial. And the third thing that we want to continue to keep our eyes on for the next couple of weeks is how connected the new cases we see are. I'm asked here several times, is there an absolute number that you're looking for? And that's a difficult question to answer because 30 cases means different things based on the context of those cases. 30 cases that are not connected is different than 30 cases that occur as a cluster or related to a specific event. And right now, we don't have enough of our cases or a high enough percentage of the cases in the district that are being connected to each other, either by a single case, contacts being connected, or a particular location. So those are the metrics that we look at. Some of them are presented on the dashboard for folks to be able to follow along. Some of them are metrics that we look at internally as public health professionals and data scientists, and they all help us paint a good quantitative and qualitative picture of the community conditions here in the District of Columbia. But I do want to reiterate that overall, out of the global set of metrics that we look at, both posted on the dashboard and those that we review internally, the district still is in a good place as it relates to our picture related to COVID-19. We still do need everyone to continue to do all of those things like wear your face mask, keep 6 feet of distance from others, choose your activities wisely, wash your hands, stay home if you're sick, all of those good preventive measures so we can keep moving our health indicators in the right direction. Thank you, Mayor.
Thank you. Thank you so much, Dr. Nesbitt. And I also want to recognize our public education team who joined us this morning, Deputy Mayor Paul Kine and Chancellor of D.C. Public Schools, Louis Farabee, both who have been working very hard with our education leaders across the city. So now I want to turn to the Chancellor to talk about DCPS's planning.
Thank you, Mayor. For months, DC Public Schools has been collaborating with our students, staff, and families to better understand some of our opportunities and successes as relates to the spring posture of learning at home and how we might approach a successful opening to the 2021 school year to start strong. We spent months gathering data through our surveys, our focus groups, and we had the opportunity to hear from over 17,000 voices among our students, staff, and families. And what we heard is there's a need to continue to ensure that there is a consistent and easy to follow schedule for families, and we are prioritizing safety. Safety will be paramount in all of our scheduling to ensure that there are robust protocols to maintain healthy conditions in our schools. We also heard the need to ensure that we continue to maximize learning. We know that the optimal learning experience for students is in-person instruction, and we intend to maximize that with scheduling that promotes the safety protocols that were referenced earlier. To do that, we are cohorting students into groups so we can maintain successful distancing and also to ensure that we can do appropriate contact tracing. And our final point, and it's represented in the data, is our commitment to ensuring that we're maintaining equity and access. And that means ensuring students have access to devices and supplies to have a successful learning experience. So to do that, we are offering choice. And one of the elements that was reflected in the data as well is to ensure that families who want to have in-person instruction have the ability to choose a hybrid model, and then also the ability to offer a virtual-only instructional model for those students who have experienced success in a virtual-only option and would like to continue that for the 2021 school year. So what I'll do next is I'll walk you through what that will look like for all of our grade levels as we have prioritized learning at home for all of our students who need that, but also to maximize instruction in person with a particular leaning towards our earliest learners. We're also prioritizing students that may have special needs, students that may have individualized educational plans, or other unique services that may need to be provided in person that cannot occur in an in-learning at home posture. So for our earliest learners, students that are pre-K3 and pre-K4, they will be provided an opportunity to have cohorting in 2 ways. There will be a group that will be on Monday and Tuesday, and then there'll be another group on Thursday and Friday, which will be our B group. Threaded throughout all of our models, Wednesday will be a virtual day and will also be a day that we'll have deep cleaning in our buildings. As we transition to K through 5, there's a similar structure. However, for K through 5, you can see that there is a virtual-only option for families Monday through Friday. And again, you see the same elements that Wednesday is a virtual-only day for deep cleaning, and then there's a group A for Monday and Tuesday, and group B for Thursday and Friday. As we transition to our secondary level, it'll look a little bit different in terms of the number of days that we'll be offering in-person instruction. You can see for our students of grades 6 through 12, there'll be 1 day of in-person instruction as the anchor, and then we'll have our virtual-only option for students 5 days a week. And then Wednesday will be our day for virtual only for all students and deep cleaning. It's important to note that those students that are in education campuses where they're being served in a pre-K through 8 grade level model, those students will work on the model for elementary students for K through 5. And those students that are, again, in 6 through 12 will operate from the current schedule presented, which is 1 day of in-person instruction and 4 days of virtual instruction. We have created this model to ensure that we are nimble and flexible, so should we need to move from an all-virtual structure to a hybrid approach, we have the ability to move back and forth. And also, we are giving families the ability to choose from these 2 options as it relates to hybrid learning and learning at home.
So I think that's the basics of what we talked about, and there's more to the discussion from DCPS's standpoint about how schools are being readied and the protocols at schools that we will use the time between now and the 31st to talk with families in town hall settings about what all of those protocols are. And Chancellor, you may be able to address some of that if there are questions today. So with that, we'll take questions. Yes, Julie?
As you're announcing this plan, but also saying you're going to wait until the 31st, does this mean that this might not be the plan? There might be...
That's correct. It means that on the 31st, depending on health indicators, we could decide that we're only going to be able to start the school year virtually and may move throughout the school year to another option. It may mean that we have determined that the trends that we see for the last week don't persist, and we are able to offer an all virtual option or a hybrid option where the students would come in on the various days that you just saw and learn virtually for the balance of the week. Yes?
To what degree does the federal government's insistence that in-person learning continues have on the decision?
It has no impact on our decision. We are driven by this value, and that is that children do better in-person, face-to-face learning with teachers in their school buildings and with their peers. So we have worked very hard to make sure that we have options available for families where that can happen, as long as our experience with the pandemic allows it. And what we're saying today is that we need more time to observe what's happening with the virus, and we will make that determination on July the 31st. Also, just logistically and operationally, the school system will need at least that much time to prepare for the new school year. That's why we picked that date. Yes.
Question for Dr. Nesbitt. Are you considering any interventions? I know you said in a June 5th press conference that you showed us a sheet that said you would consider possible interventions if 3 days of new cases were higher than day 0. I'm referring here to community spread. And looking at it, it looks like we had 3 days that were higher than day 0, which is 44. And so I'm wondering, right now, your concerns over these 3 metrics, are you recommending interventions?
Right, so that just happened today, right? Mm-hmm. So what we do is we actually look at if we can make any connections around what those cases are. And what we're still observing is that there are no real observable connectivity or trends in our cases. So we're not seeing clusters associated with any particular location, or any types of venues. So it makes it very difficult to make a recommendation or for a specific intervention on a specific sector at this point. What we will do at DC Health is over the next couple of days is continue to mine the data, continue to look at the cases that have happened during that symptom onset period to see if we can paint a more specific picture that helps us make recommendation for interventions. And if we can identify something that we can say is the source or the reason why those cases are happening, we will be able to make a recommendation for a specific non-pharmaceutical intervention. But writ large, what we continue to see is that the cases are happening widespread across the community with no real level or sense of connectivity.
Yes.
Mayor Bowser, what impact did possible protests by teachers cause you all to delay the school's announcement and also the walkthrough this morning at Maury Elementary?
What was the second part of your question?
The walkthrough at Maury Elementary.
What about the walkthrough?
What impact did possible protests by teachers play a factor, if any, in delaying the school's announcement and also canceling the walkthrough this morning?
Well, none. Actually, and the Chancellor Farabee will jump in, I have found our conversations with teachers to be productive. They are educators, and so they know better than most the value of children being in school with their peers and with their teachers. And I think that we are all working in an unprecedented situation to make sure that teachers and students and families are confident in their learning environment. So I think that was a very, I think we've had fruitful conversations. And with regard to Maury, let me apologize if any of you were inconvenienced by that. And the school, we want to show you how we're distancing in schools and preparing for parents, and we can still do that. But we needed to be here today. Yes.
Chancellor Farabee, could you expound a little bit more on this plan to open schools for 2 days, close for a day of cleaning, then have some digital learning during that time, and then reopening schools for another 1/3 of the students? It seems somewhat convoluted to people who aren't professionals. How does a working parent or a guardian schedule his or her work days with wherever they work if their kids are home some days and not home some days? It seems quite convoluted for parents to figure out.
Yeah, ideally, we would have all 5 days of in-person instruction available to families, and that would obviously be the most convenient way for families to plan. However, we know that there isn't a clear path for us to have all of our students in the building 5 days a week and still maintain the protocols that we've established that represents the guidance that we receive from DC Health and also represents guidance from the CDC. And so given the guidance that we receive, we know that face coverings, social distancing are effective in reducing infections. And to maintain that, we know that we need to limit the number of students that are in the building together at one time and also have proper cohorting. And to do that, we can only have a portion of students in the building. And this schedule represents the maximum amount of students that we would have in the building at one point in time. For example, it represents a ratio of about 12 individuals in a classroom. So you can imagine that's about half of what you might have on a traditional operation. And so given that, we know that we have to put students in cohorts, and cohort A would represent about 50% of the students that are in-person instruction through the hybrid model, and then cohort B would represent the other 50%. And we believe that's the best way to maximize in-person learning, but also maintain safety as a key priority.
Thank you very much. My only concern about that is if you are a parent or a guardian and you have an elementary school student, a middle school student, and or a high school student, the 2 days in which they might be going to school could be significantly different. And you have a job you have to go to every day.
Yeah, we would prioritize in this process if families give us their intent that they would like to have in-person instruction on the hybrid model, to prioritize sibling preference. And we've done sibling preferencing in other areas as well to ensure that we can make those schedules as convenient as possible for families who have siblings across grade levels.
Yes, could you introduce yourself?
Hi, I'm Jane Rucker from Washingtonian magazine. Dr. Nesbitt, it seems like you do have a robust group of contact tracers that are very effective in getting in touch with people. However, it's still taking 5-10 days to get test results back. That's 5 or 10 days that those contact tracers can't reach out to the contacts of positive individuals. So I know you said in the past, there's nothing the district can do about that. It's because the labs are overwhelmed. But is the speed in which you can get test results a metric that you're following in terms of looking forward to further reopening and whether we need to start rolling some of these things back?
Yes, we look at turnaround time for the city overall on a daily basis. Today it's around 3.87 days. 3.87 days is the citywide turnaround time.
Okay. Who hasn't asked a question? Mark?
So is in-person optional for every student? What is the option parents would be faced with? Would they be able to choose either to send their kids in for hybrid or all virtual learning? That'll be every student will have that choice?
On July 31st, we will know if we are able to make that option available. So we will report to you whether we're going to have an all virtual environment to start school, or if we will be able to offer all virtual. That will always be an option. Or if we're able to add the option of hybrid, that you come in for a couple of days or you come in for 1 day, depending on your grade level. And then your question is a good one, if we will be able to support hybrid for everybody who wants it. And that is our goal. It is only limited by our staffing concerns. And I can't answer that question until we know what the health data say and then we know what parents want. So on July 31st, if we're able to offer the hybrid, we're then going to ask parents to register and then match that up with our staffing availability.
And so just to clarify, virtual learning, regardless of what the data show going forward by July 31st, virtual learning would be an option for every single student?
Every single student. And if you could go back to slide 7, we'll show this, that there will always be a virtual option. And actually, if you could go to, let's start with slide 9. And you see the bottom row is the all virtual group of kids. So parents who elect all virtual. You see that through K through 5. And you also see that on 6 through 12. and all virtual. Virtual is not an option for our youngest learners, pre-K 3 and 4.
Currently, it is not an option.
Okay, and then can I ask, what are the options for the teachers and staff?
Mm-hmm.
Can they opt out of in-person classroom work if they either feel it's not safe for them because of their own underlying health conditions?
Well, that's a kind of a premature question right now, Mark, because we're not there with knowing what we're going to be able to offer, but we will say that on July 31st. And second, we don't know how many parents and children are going to opt in to in-person. And so when we know that, we will know the match of parent preferences and teacher preferences. But we also have available COVID-related leave for all of our employees.
That's paid leave?
It is.
And then if I could ask one more question about sports. Have you made a determination about contact sports, if they will resume, if school resumes? Will we have football, basketball?
We actually haven't talked about it, but I'm just going to, it's not our first priority, unfortunately. Yes.
Mayor, I don't know if this is for you or for Deputy Mayor Kine, but I've heard that a number of the charters who educate almost half the kids in the city are sort of looking at you to find out kind of what you're going to do with DCPS, so they can either follow suit or maybe not. But the question is there any direction at this point, suggestion, anything with respect to the public charter schools?
Sure, I'm going to ask Paul to weigh in. It is true DCPS has about 50% of the kids, and the balance of DC kids are in how many different charters? Over 60 different charters. So imagine if everybody had a different schedule. We think it's best if people have a similar schedule, and if they go back to one of the scenarios that are outlined on slides 8 through 10. If we all were to do that, either the campuses would be all virtual or have some in-person learning and some virtual learning. So we think that the charters will fall in one of these scenarios, and I'll ask Paul to comment more.
Yeah, as a city, we are very much all in this together, and I think we've demonstrated that throughout the spring, which has seen unprecedented levels of collaboration across all our public schools, with our families, with our educators, with our health experts. I meet with the leaders of all the charter schools at least twice a week. We have conversations about what they're learning and understanding from their communities. We share data and information. We convey all of the scientific evidence that we have available to us. We make DC health officials regularly available to leaders of charter schools. And together, we have worked on developing these recommendations and these schedules and these scenarios. Each charter has the ability to make its own decision about what its schedule is going to be. At the same time, many charter leaders have conveyed they are interested in working together and collaboratively with DCPS and with the city on these schedules. So I know that the message we have for charter leaders today is we need to hold off and wait as we follow the data and information coming from DC Health. We assume that many will follow suit. And at the same time, we know that they put the best interests of children and families first, as does DCPS. So we can expect, I think, very similar outcomes from our own deliberations.
I do know, for example, though, that KIPP says that they are going to be starting their school, at least that's their plan, the 21st of August, as opposed to, I think the DCPS plan is the 31st, if I'm not mistaken. So there could be, obviously, changes there, right? Differences.
Yeah, there are very possibly going to be some differences. The vast majority of charter LEAs have indicated to me they're planning to start their school year on the 31st. KIPP is a very good example. They're beginning their school year, but they are bringing in individual students and small cohorts, and will begin also some regular instruction around the time that DCPS does. And you'll see that for all of the large charter LEAs who are planning on August 31st as well.
So finally, Mayor, the way I get it is basically you're suggesting the charters just do what DCPS does in a general way. Is that correct?
I always think that's a good idea, but they always tell me that it's up to them. because they're independent LEAs. And so we respect their decisions. Many of them work with their boards. I take the approach that they're all our kids. So it really matters not to me whether they're DCPS or public charter, or families want to know that there is clear reasoning behind decisions made. And we've worked collaboratively with them. DC Health has worked collaboratively with them. And we just want families to have the best information. Yes.
What is the COVID rate or benchmark or threshold to make a determination for in-classroom instruction? For example, if the rate drops by July 31st, will the students and staff be in school?
So Dr. Nesbitt talked to you about several indicators that presented as concerns for us this week, and we will continue to follow those. Yes?
Another question on education. Last I heard, there were, 10,000 devices to students in need and 4,000 hotspots. I wonder if you've done an audit to check in if any more students need devices so they can do distance learning.
Yeah, thank you. We have done some assessment over the summer to ensure that every student who is engaged in our summer learning has access to a device if they need a device. We have also had students keep their devices if they're engaged in summer youth employment as well. A part of the registration process will also include an opportunity to families to share if there is a need for a device in the home. We're also in the process of procuring additional devices, so we'll have additional devices as we prepare to open to the 2021 school year. We'll have approximately 36,000 devices. We distribute over 10,000 devices in the spring of the 1920 school year, and we also distribute about 5,000 hotspots. The new devices that we will have for the 2020 school year will be LTE enabled, so that allows us to eliminate the need for additional hotspots. And we have the capacity to provide internet access with those devices should family need internet access as well.
So to be clear, I guess internal audit, your understanding is like of the 51,000 students who are that every student who needs a device has a device, or?
That is always the plan, that every student who needs a device, we're providing a device, and that was our posture in the spring and has been our posture over the summer. And we're preparing and procuring devices so we can continue that into the 2021 school year.
And then another question for Dr. Nesbitt. I know the American Clinical Laboratory Association, which I know LabCorp is a member of, has said publicly that they're having significant supply challenges. Obviously, you've discussed this during press conferences. They also are asking providers to prioritize testing for those in need. I wonder if that is going to change the way that DC providers, or are you changing the way that we do testing based on the significant supply challenges that private labs are experiencing?
So you'll recall that we used to present to you all a priority list, right? And no one really grasped that. And then we had people sort of get oriented to this, work with your doctor to determine if you need a test. And now we communicate to people, if you need a test, get a test. And most people interpret that to mean I want to get tested, and therefore I go to get tested. And so what many of these laboratories are trying to communicate to people is that the diagnostic tests that are broadly available are intended for people who have a reason to need to be tested. So there are, in some communities, and I don't believe that it is happening here in the district, some communities where people want to be tested and they go to be tested, which puts stresses on the availability of supplies, whether it be the swabs, whether it be the vials, whether it be the reagents in the laboratory, that are contributing to some of these long wait times for results. Principally, what we understand happens in the district often is that people who are going to be tested, going to a place to be tested, are people who have symptoms or asymptomatic individuals who have had an exposure. And so those are people who are appropriate for testing, who have had consultation with their healthcare provider, or who have been advised to go get tested. So you will see in some communities where when the wait times are long enough, they are going back to prioritizing who should be tested and advising that clinicians who are making the decisions around testing prioritize those individuals so that you don't have really sick people who the clinicians and the public health professionals who are making decisions around the public health management and the clinical management of those individuals are not getting results, where people who have the desire to know their status but no known exposure, no symptoms, are getting ahead of them in the queue for a COVID test.
Tom?
Thank you, Mayor. You just said appropriately that all the children in the school system, charter or not, are our children. Would it be appropriate for the mayor and you and the council to maybe pass legislation that during the pandemic, that your charter schools at minimum have to follow the same schedule as the public schools to bring some order to the chaos of everyone doing whatever the hell they want?
I have that authority if there is a public health reason for the charters to do or not to do something. So I believe I have the authority I need.
So would you consider asking or telling the charter schools, whatever they teach, that they have to have the same days that the schools have?
If this is where if they were, for example, trying to open for 5 days a week when we thought that the health indicators would not allow it, then I would intervene on that decision. Yes.
Dr. Nesbitt, correct me if I'm wrong, but as you said, it doesn't seem like there's any one clear activity or locale that's the reason for these increased case numbers, the reason for this increase in transmission, and that if you could identify that, you would, react appropriately. However, it does seem imperative that we bring this transmission rate down. So how do you plan to bring that number down while keeping the current opening status as is?
So we're all in this together. So you'll hear the mayor say often, this is our shared responsibility and our special responsibility. And part of the reasons why we have these situational updates is to make sure that district residents, district business owners, and all of us who are here in our community understand where we are, understand where our health indicators are, and do our part to help make sure that we move our health indicators in the right direction. We have lots of conversations in this community across the world about the promise of a vaccine. We want people to understand that we can change the trajectory of COVID-19 in our communities prior to a vaccine by doing the things that make a difference. Wearing a mask, keeping 6 feet of distance, and choosing our activities wisely. We have indoor dining, we have personal care services, we have a host of activities, none of which at this time are rising to the top on our radar at DC Health. And again, we do constant analysis, primary data analysis, secondary analysis to try to find a single contributor, none of which again have come to the top of that list. And so we need individuals to help us help make a difference in those decisions. When you're going out, ask yourself, as the mayor says, do I really need to be there? Do I really need to go? And if you do, you need to wear a face mask. You need to keep 6 feet of distance from people who aren't in your household. If you don't feel well, don't go to work. We need people to still be making those types of decisions and asking themselves those types of questions. If you run a business, you have employees, what are you doing to make sure that your employees don't present themselves to work while they are sick, causing a risk for other employees and patrons of your business? So those are the types of things that we're all going to have to be in it together in terms of our special responsibility and our shared responsibility to change the trajectory in the district.
And so currently in DC, you're only required to wear a mask if you are inside or if you can't stay 6 feet apart from people. Would you consider expanding that to make sure that people will have to wear masks anytime that they are in public, regardless of whether they can social distance or not?
So we have a number of guidance documents that we have right now where we're looking and we're reviewing the language of those in terms of how people are interpreting our mandate for masks, and you should look forward to some additional guidance on that.
And about when would we expect?
Correct.
When would you?
So we've updated our our guidance document on the use of masks, but because there's a lot of confusion about the district's order for wearing masks, we're going to be making some changes, and you should look for that in terms of how people should interpret where you wear a mask and where it is required in the District of Columbia.
And then when can we expect those changes?
In the coming days.
Great, thank you.
Okay, trying to figure out who's next. Sam.
Okay, Mayor. So parents sent me this question, and I just want to ask it. Any home visits to assure that the students who are virtually learning are, one, safe at home, eating at home, or have the proper setup for productivity?
Is the question, are we currently facilitating home visits?
Basically, if you're going to virtual education, is there anybody going to be checking, I guess, basically, the fact that regardless of what model, what structure, and we're always going to be engaged with our students, and we're always going to be checking on their well-being. We believe we can do that virtually. We have done that virtually. We have also elevated some of our practices for home visits to be in a virtual posture. DC Public Schools proudly leads the nation in home visits. We've done thousands of home visits, but we've found ways to do that in online fashion. We have also elevated our mentoring and supports for students that can be done virtually. And we also are doing regular check-ins with our students to ensure that they have the essentials along with ensuring that they are being supported academically. And that will continue regardless of whether a young person is engaged in the hybrid in-person model or whether they're learning at home. How do you do a virtual home visit?
We follow the similar protocols that we do for our in-home visits. We have the family tell us what's the best time for them to check in, and we schedule that time, and we use our platforms for students and families to go online, and we're able to see the student and the family, and we're able to have conversations around what their needs are, what their experiences are, and how we can best support them.
Any physical home visits?
We have not done any physical home visits at this point, and if we're able to do so, the health conditions will obviously drive that decision.
Yes.
Yeah, just a quick question for Dr. Nesbitt. I just wanted to, you mentioned 3 metrics of concern. I just wanted to make sure I had them correctly on the top end. Rate of transmission, level of community spread, and what I wrote down was how connected the cases we see are. I think I messed that up. Did you?
Correct. You've got it.
Walk me through those 3.
You've got it. You've got it.
Okay, cool. I just wanted to make sure.
Mark, I'm just going to go this way,
Just
guys.
clarifying again on
Yes.
you're very clear on everyone has the option to virtual learn, but am I right in understanding that you don't know whether it depends on demand versus your ability to provide in-person hybrid? Is that right? You think there might be a situation where demand outweighs your capacity? Did I make that more confusing than I needed to?
I think that's a possibility. I'm not saying I think it's an eventuality.
Okay. And then can I ask about school nurses? What is the plan once students go back to school, if they do go back for in-person learning, to have a school nurse in every single school?
Who wants to answer, DCPS?
So we have had regular conversations with Children's Hospital that currently manages the contract for our school nurses and redefining what the roles are for school nurses. Majority of our schools have school nurses. However, there are a few schools that do not. We'll continue to prioritize their service based on the needs of those particular school communities.
A full-time nurse every day in every school with the ability to deal with the possibility of taking temperatures, making the determination whether a student or staff member needs to leave school, be quarantined, be tested?
So we're defining those roles. Obviously, one person cannot do all that you've just described. However, we will continue to lean on our school nurses. As I mentioned earlier, majority of our schools do have school nurses.
Full-time?
Yes, majority of our schools have full-time school nurses.
And then what about meals, student meals and the grocery pickups that have been going on at schools during the COVID response? Will that continue, and will students, regardless of whether we're in a hybrid position, posture, or virtual posture come July or August, will the school meal programs and the grocery distribution continue?
Yes, Chris, could you just talk about how we're handling the meals for students?
Sure. I think that the chancellor may be able to do the school meals for the students a little better. I will say that we're going to transfer the operations of where we're doing the grocery distribution from schools to our recreation centers that are close to there. We have a plan to do that, but we are waiting with everything else to see if we need to execute that or not. Clearly, if we can keep folks going where they're going now, from my perspective, not from the chancellor's, that's easier. For us on the food distribution side, if we do go to in-person at the schools, we will adjust what we're doing for the grocery distribution and some food distribution as well.
And how is that going to the grocery? I kind of lost track. Are you still distributing as
Yes.
many groceries as you were when
Yes.
you ramped up?
Yes.
Thanks.
Thank you. So we've been in phase 2 for a while now, and some of these metrics that Dr. Nesbitt brought up have not changed for a while. Mayor, could you explain what it was that you saw yesterday or today that made you realize you weren't ready to make this announcement about schools yet?
We had to answer 2 questions. 2 questions had to be answered to my satisfaction. And that was what circumstances would necessitate a change in posture before August 31st. And after we had in-person learning, what circumstances would necessitate us rolling back to an all virtual learning. And I think that the answers to the first question, what would necessitate if we made a decision today, what would cause us to have to revisit that decision before school started on August 10th or August 31st. And I think that there are answers from DC Health or that we were close right now. And so for me, we want to, just because we're thinking about a week's worth of information to see if that information holds or improves in the next 2 weeks. And we have 2 weeks to look at that information and still give DCPS time for on-time opening. To answer your question?
Somewhat. Do you believe that there is still a possibility in that month between July 31st and August 31st of needing to change course?
I'm not sure I follow you.
If you're saying that give it 2 weeks makes it less likely that by August 31st you would need to change the plan.
Yes, that's correct.
So is there still, is that the point, like 2 weeks from now we know this is the plan we're going forward?
We have to make a decision in 2 weeks from now. And if I could follow your question to say, could things improve after that and will make us feel, yes, that could happen. But we need some finality for operational planning by that time. Yes.
I see that we are thinking through plans for in-school instruction. Have we talked through plans if COVID is detected in the school?
Come again?
Well, if we're thinking through planning for if students come to in-person instruction, have we planned for what will happen if COVID is detected in the school, either in staff or students?
Yes, if you're asking what would be the communications plan.
And what would you do? Would people have to stay home for 2 weeks? Would the teachers have to quarantine? Is school canceled for both A group and B group? What happens?
Yes, so we would be prepared to talk, but the answer to your question is yes. And the whole design around cohorting is to limit exposures to small groups. So if there is COVID detected in that small group, the rest of the groups aren't implicated. So that's kind of the logic, the public health rationale behind putting kids and adults into small cohorts.
So staff and teachers are also in the A and B cohort?
Is that how you would describe it?
That is correct. So a educator would be assigned to a cohort, and they would be with that cohort of students throughout the day. So that would allow us to contact trace appropriately.
And when a parent selects an option, if they have an option, are they required to commit to that option?
Oh, great question. Thank you. Chancellor, would you talk about that?
So it is easier for us to manage a transition from in-person, the hybrid structure, to virtual. As you can imagine, it's a lot more complicated and complex to transition from virtual to in-person based on the staffing needs and the ratios that we're maintaining. And so we would be asking families to make a commitment for a period of time. The current thinking is that would be for one term. It allows us to ensure that we could make a clean transition as it relates to where students are in their academic studies, but also where they are with their grading as well.
And that a term is?
Yeah, so the term for the first term ends in the end of October, and so the second term begins, I believe, around November 6th.
So they can change their minds November.
So we would start communicating with families in advance of the end of the term to determine if there are any families that would like to make a change, and then that change would occur at the start of the second term.
And one last question. I'm one of these parents. I'm a DCPS parent. What kind of support will be offered to the parents, many of whom are working and trying to fill difficult roles as teachers at the same time?
Great question. What's fascinating, there was a question earlier about home visits, and what we see is the demand and interest for parent support has been elevated, and we've seen record numbers in our parent university sessions. And we have seen that as a great avenue to have families get more information about key areas of interest, such as our platforms for learning, how to access Aspen and how to access other information, and then how to support students at home. And so we'll continue to provide that information and offer sessions to families of how to be a support for learning at home, but also how to utilize all the tools that DCPS will launch as we move towards the opening of the 2021 school year.
Yes, Tom.
Thank you. Chancellor, there's the Council of School Officers that represents principals and other administrators, and there's the Washington Teachers Union. I don't think there are any large ones other than those two. Are those two organizations, are they at the table as this is being discussed, or are they only consulted when you feel like you need to bring them in?
So we're in regular conversation with both of those union partners, and we also are in conversation with ASME, which represents another portion of our employee group. The conversations have been very productive. The conversations have been more frequent with the Washington Teachers Union as we've had more conversation around the expectations for educators. The conversation a little bit different with the school officers, which represents our school administrators. But Mr. Jackson and Ms. Davis and I are in regular communication. We just had a session with the Washington Teachers Union on Wednesday. We've committed to more ongoing conversations to help them better understand what our safety protocols are and how we will navigate the proposed schedules.
And if I could follow that up, in the contract with the teachers union and the council, there are working rules of what can be done, what can't be done. Are there any rules that would allow the unions, either of those two unions, to have any kind of veto power over what you decide to do?
Yeah, so we are building our plans around, our CBAs, collective bargaining agreements.
Okay, thank you.
And so I don't anticipate that there'll be a need to have a veto as you describe, and we'll continue to ensure that we're partnered around how we keep our students and our staff safe.
Okay, last questions. Yes.
Just looking at this, it says like hybrid schedule is dependent on staff capacity given. I wonder, is it also dependent on giving everyone, will everyone have PPE and will masks be mandatory? I'm wondering about.
Yes, to both of those questions.
Thank you.
I have two questions for the Chancellor. The Teachers Union has said that they're being told that no additional cleaning staff is being hired. If the school district moves to in-person instruction, do you plan to hire more cleaning staff in terms of maintaining safety?
So we're confident that our current staffing model supports the deep cleaning that I referenced earlier on Wednesdays, which would be our all virtual days, and also our current staffing can meet the needs for cleaning throughout the other hybrid in-person days. And so when we need additional support, our posture previously has been to contract that support. And we will do so as needed. However, we don't believe there's a need at this time to hire additional staff.
And then one other question, if you can clarify specifically how you report if a DCPS staffer or student tests positive for COVID-19. Will you identify the individual? Will you let
You're trying to get me in trouble with Dr. Nesbitt, right? We would never identify an individual.
Even if it's not publicly to the school community or the families or parents?
No.
So what is the process?
You don't identify an individual. So school environments are not, they're not exempt from that. So what will happen is that whether it be a teacher, a student, or anyone, close contacts, which in this situation, as the mayor has described, the cohort model helps us to restrict the close contacts to that cohort, whether it be the teacher or staff member in that cohort or the child in that cohort. And the chancellor can talk more about the plans for notification to the school community, but there is an intent for transparency to communicate that there is a positive case in the school. But there is never a need to make the individual's name or any other identifying characteristics about that individual known. The health department has the ability to get their work done otherwise in terms of contact tracing. So we are in the business of protecting privacy and identity, and we'll continue to do that as it relates to cases in the school environment. One of the things that we appreciate about the chancellor's communication strategy is that it's a great opportunity to remind people about the prevention things that they should be doing in the school if and when there is a positive case. So reminding people about the community hygiene responsibility that they have to not come to school or work if you are sick, and then to also remind them of the cleaning and disinfecting practices and protocols that will be in place if and when there is a positive case in a student or a teacher.
Okay, last
Just a clarification on the teachers, staff, and the groups of students. So if a teacher is just going to teach one group, so for instance, in a 6th grade scenario, group C goes to school on Monday, that teacher would only go to school on Monday, and then that teacher would also work from home the other 5 days, the other 4 days? Is that how it works?
Can you show slide 10?
Yeah, so it could be different. So you could have an educator that's in person on Monday, but they're also in person on Tuesday with another group. However, they're with that one cohort, and they're primarily with that one cohort throughout the day.
Right, so then that would mean that if there's a teacher or an educator who tests positive, who has contact with more than one group, then more than one group would have to quarantine, correct?
So the goal is always to limit the number of cohorts that an educator or an adult would have in contact. But if there were to be a positive case with an adult that had contact with more than one cohort, we would then have to communicate with that individual and those individuals that have been in close contact with that adult.
Right, so I guess my question is that educators will have contact with more than one group, while students will remain confined to one group. Educators will...
It will depend on the role of that educator. In some cases, you could be a 3rd grade teacher and you're assigned to cohort A, and you're only supporting cohort A when they're in-person instruction, and then you're supporting them virtually. But there could be other ways where an adult could have contact with multiple cohorts. But of course, always we would limit that as much as possible.
Mayor, I apologize, I could just follow that up. Some school systems recognizing the complications and the somewhat convoluted system you're trying to create, would it not make more sense simply to do, I think it's one of the schools in this region, just have online learning at the beginning of the school year and see how that's working out, and then transfer into in-school learning, say in January or after the holidays, to get some sense that you have some continuity. Because again, just trying to figure out who's going to go to which class on what day and who's going to come in to watch
It's a schedule, Tom. It's a schedule. And while it may seem convoluted, it's because none of us are familiar with it. And I wouldn't want to say, let's just do X in the face of a pandemic as if we all have all the answers. We start with this value, that children are better served in their classrooms with their teachers and their peers. And none of us know the impact of having our kids out of school for up to a year. We can guess, we can probably estimate, but I think we all know that it's not ideal for learning, both academically and social and emotionally. It may be that the health indicators suggest that we can't come back in person. That may be. And maybe we won't be able to come back until January, but I don't think we know that yet. And this school system is going to do everything that we can with all of the information that we have to make the best decisions for kids and their families and our staff.
Thank you.
Okay, thank you, everybody.